Hi, my name is Alessandra. Welcome back to my YouTube channel, and today we're going to be talking about syphilis. Syphilis is caused by bacterial infection spread mainly through sexual contact. It consists of sores around the genitals, the rectum, the mouth, the hands, and the feet, and these sores are typically painless, but it comes in stages, which we'll talk about later. It's caused by the bacteria Treponema pallidum, and it's estimated that about 45 million people are infected, with 6 million new cases a year. This is, of course, a concerning rise in syphilis cases. According to these graphs, it's very prevalent among the homosexual community. In 4 years, you see a very drastic increase among SMM, or men who have sex with men, compared to MSW, or women who have sex with women. Race-wise, the black community seem to have a significant more cases, and this has also been rising in recent years. This is some more information on the bacteria Treponema pallidum. It's a gram-negative bacteria and it's an obligate parasite. This signifies that it needs a host to survive. So it's difficult to culture in a laboratory settings. In fact, only recently I think they were able to accomplish this, and it does not have an animal reservoir. It does, however, have the ability to remain in our body for a very long time, which we'll discuss in the latent phase later. It's able to avoid the immune responses because its antibodies aren't spread out among the surface area. It has a corkscrew shape, as you can see down here, and often some cells in the immune system aren't able to recognize its existence. It's a spirochete and it has endoflagella. So as I said before, syphilis advances in stages. The first stage is the primary stage, which is when the infected victim develops sores around the original site of infection, which is usually going to be the genital areas because it's a sexually transmitted disease. And these sores often go unnoticed because they are small, firm, painless, and once again, they're in the private areas. So many people aren't aware that they have the disease. Plus, the stage lasts about 3 to 6 weeks, and the symptoms appear to go away, so many victims believe that they're cured, when in reality it's advancing into the next stage. This is the secondary stage, which consists of a skin rash, swollen lymph nodes, fever, mucous membrane lesions, fatigue, or muscle aches. And even though the disease begins to take effect, many people once again fail to take notice of the symptoms, which allow the bacteria to slip into the latent phase. During this time, it's not contagious, unlike the primary and the secondary stage, and it remains in the body for a very long time. Once again, as I mentioned before, the bacteria is able to evade a lot of host immune responses due to its low surface proteins, and it's able to just remain dormant for many years. Some people actually skip this phase, so it's not considered one of the phases in many sources that I read. But anyway, it leads to the third and most severe stage, which is tertiary. This is the part where the bacteria starts to multiply, it starts to really take effect into many organ systems. During this time, it's not infectious, but it does affect major organ systems, such as the central nervous system, the brain, the heart, the liver, the kidneys, and it leads into a cascade of different diseases. Three main diseases that arise during the tertiary phase is known as neurosyphilis, ocular syphilis, and congenital syphilis. Neurosyphilis is defined as a dysfunction of the nervous system, leading to maybe uncoordinated muscle movements, paralysis, and numbness or dementia. These are characterized into these 5 categories, where it's asymptomatic neurosyphilis, which is where no noticeable symptoms are observed. There's meningeal neurosyphilis, which are just headaches, stiff neck, vomiting, and seizures. There's meningococcal neurosyphilis, which causes stroke, the general paresis, which is just mood changes, and the tabes doralis syphilis, which is muscle discoordination and vision loss. So all these are effects of syphilis affecting certain areas of the brain, which we'll talk about pathways in a little bit. But mainly, if the disease can get to this stage, it often leads to death. And a long time ago, it was known as the insanity stage, which were victims would just go crazy as basically their brain was rotting. The next disease is ocular syphilis, which is shown in this picture here, just causes inflammation in the eyes and can lead to vision loss. Congenital syphilis is whenever syphilis is transferred from the mother to the child, and it is a high infant mortality rate as the child develops the bacteria as well and certain symptoms. This is the mechanism of Treponema pallidum, which is kind of cool. So first, mainly, although the bacteria isn't really detected by the body, the ones that are detected release a type of lipoprotein, which causes all the inflammatory responses, which eventually leads to the very severe tertiary stage. So how this happens is that it presents a certain antigen known as TPF1, and as it's displayed on the cells, it releases a lot of cytokines, which have interleukins and are responsible for pro-angiogenic responses and pro-inflammatory responses, and this leads to more antibody production and a macrophage activation. But the most important effect here is the inflammatory factors that it produces. This causes the lesions, actually, the growth factors that it produces. It causes endoarthritis, and the central nervous system is later infected. So as the arteries are inflamed, it affects many blood flow to the central nervous system, which begins to infect the brain and causes the insanity that we discussed earlier, and of course the effects in different regions of the brain. As I mentioned before, syphilis can often go unnoticed, especially during the primary and secondary and latent stages, as the symptoms just aren't as severe as tertiary, and it often appears to be self-curing. So many confirmation tests are needed to diagnose syphilis. The first one is a blood test, or it just measured general antibodies, making sure that it's producing inflammatory responses. And then we go into a second blood test, which is a little more specific to syphilis, and it measures that the anti-lipid antibodies, specifically that syphilis or the Treponema pallidum bacteria produces. The third test is a cerebrospinal fluid, which is where if you are suspected of having neurosyphilis or it's beginning to affect your nervous system, the doctor may suggest collecting a sample of your spinal fluid through a procedure called a lumbar puncture, which is just a spinal tap. Some treatment options for syphilis is penicillin, and this is widespread. One of the only treatment options that I found. Penicillin is very effective towards syphilis, and it's administered in different doses throughout the stages. For the primary stage and the secondary, you have benzathine penicillin G, which is just a few doses given to you during this time if they can prove that you have syphilis. During the tertiary stage, which is much more effective, you actually use something called aqueous crystalline penicillin, which is just a more potent form and is highly effective towards the disease. Syphilis, however, does not revert any damages already done. Although the lesions may heal over time, you may have scarring if it gets into the tertiary stages and you have ocular syphilis. The blindness is not reversible, and neither is any damages done to the brain. So you may experience some discoordination, muscle loss, brain loss for the rest of your life. Syphilis does not have a vaccine, but in studies done in 2008, they were able to prevent rabbits from getting this disease, and the research is very early in stages, but as of right now, there's hope for a vaccine in the future, which would be very groundbreaking because it would be one of the only STIs that have a vaccine. So here's a quick outline of the history of syphilis, and I think it's really cool. In 1492, it was theorized that Columbus is actually the one that introduced syphilis to Europe. There's two lines of theories, the pre-Columbus theory and the post-Columbus theory, which settles around his voyage. The pre-Columbus theory assumes that syphilis was already in Europe at the time. It just maybe wasn't recognized, as syphilis is often mistaken for maybe other STDs. And the post-Columbus theory, which indicates that syphilis did come from the New World, is shown by skeletal models, and it's actually really fascinating. I just don't have time to get into it right now. But you guys should look into a llama theory, which is kind of gross, but it's kind of funny. The first case was documented and observed in 1495, which is maybe a year after Columbus came back from his voyage, and it was observed among the French troops in their invasion of Italy. It was known as a great imitator at the time because it was confused for many other diseases that they observed, and it was quoted as never before seen in Europe. This disease was treated just as leprosy was. They would outcast people. It would be a sign of Immorality, because it was common among prostitutes as it is a sexually transmitted disease. It was seen as an outward sign of sin, and at the time, according to documents, it's theorized that the symptoms were actually much more severe.
It causes a severe change of face.
Like in this photograph, it shows her face caving in, or especially around the nose area, which is also a tertiary symptom of getting syphilis. Moving on, Syphilis is named after the Syphilis poem by an unknown author, and it's where a Greek shepherd is blaming Apollo for this drought, and he tries to fight him for some reason, and he was struck with the disease, which they named syphilis. In about the 1500s, they put certain areas in Europe put restrictions on brothels because it's a sexually transmitted disease, so this is their early methods of trying to contain the spread. And it was also prevalent in the 1900s, where World War I was beginning, and it leads on to World War II. And in the trenches, syphilis was also spread, and it became a very serious affair up until the synthesis of penicillin in 1928 with Alexander Fleming, which is used as a cure. Modern day, there is a large increase in syphilis cases, which is theorized because there's just a more liberation and a acceptance of a sexual orientation, leading to an increase in STDs, not just syphilis, but all sorts of different effects. And this is becoming a serious problem, but we are able to look into vaccines at the time, and of course we do have the cure. So that's all I have for my report, except for one last fact. Hitler was supposedly affected with syphilis, which is kind of funny, and there's a rumor that he got it from a Jewish prostitute, but that's just a rumor. It was based on some journals that they found his personal doctor to have, which I think is kind of funny. Okay, so thank you for watching, and have a great day.